Hello, I'm Amara Razgis with Consulting Specifying Engineer. I'm here today with Darren Harvey, a principal at Smith Seckman Reid. Darren has an extensive background in healthcare as a mechanical engineer and as a project executive. Darren is focused on growing SSR's healthcare and health science presence in Texas. Under his leadership, SSR has partnered with owners, architects, and industry peers on award-winning healthcare facilities. It's great to talk with you today, Darren.
Thank you. Appreciate you being here.
Yeah, so let's jump right into this subject. It is a very topical subject to talk about. So what do you see occurring in healthcare construction as we're coming out of the COVID-19 pandemic?
Yeah, thank you. It's been very interesting. I guess the biggest thing that we're seeing is a whole lot of pent-up demand. Healthcare was busy before the pandemic hit, and I think some market sectors slowed down as we went through the pandemic, and we certainly had our share of projects go on hold. But those projects got backfilled by other projects modifying existing systems in healthcare to deal with the pandemic. More triage rooms, more operating rooms under negative pressure, certainly patient rooms under negative pressure. So we've just seen now that we're coming out of that, the pandemic, so to speak, we're just seeing a lot of those earlier projects that went on hold coming back, and everybody rushing to get back to where they were in 2020. I would say from a patient care side, there was a lot of procedures got canceled, a lot of elective procedures got canceled because it was just too dangerous to have people in the hospitals. And so those people don't want to wait any longer. So they're all pushing. There's surgeries going on Saturdays and Sundays with some of our clients, whereas typically they would have those 2 days off. So there's just been this really huge push to grow more, build more, and keep everything operating really quickly. I think in Texas specifically, there's a lot of population growth before the pandemic and even all the way through the pandemic. Folks moving to Texas, and just the sheer population growth is also driving up that push for more facilities. So it's a very busy market here, has been all the way through the pandemic. So which is a good thing for us.
Sure. So you're busy.
Yeah.
How has the pandemic changed the way you approach healthcare design, and then how have those healthcare facility managers? How have their priorities changed?
Yeah, so I'd like to consider ourselves as any engineer for that matter, as a trusted resource for healthcare owners. We tend to build relationships with them and keep doing projects over and over at the same hospital, and really get to know the people that we're designing and building things for. So they trust us. And when the pandemic hit, immediately they start calling us asking, what do we do? Do we add filters? Do we, how do we modify these systems? And in some cases, it was real easy. In other cases, the infrastructure just wasn't there to do what they needed to do. And of course, everybody, the vendors out there all had their ideas and suggestions, but we were going through some pretty uncharted water for a long time. And there were some clients we had to tell just, honestly, we don't know. This is too new. There's been nothing proving. As an engineer, we like to be factual and not speculate on some of these filtration products that came out, and people were buying them left and right and putting them in their air handling unit systems. And some of them got in trouble for doing that. There were some lawsuits that shook out from all that. But we tried to stay the course. And at this point, we do know what works and what doesn't work, which is relieving. But it was kind of a challenging time there for a while, staying consistent with what we were telling different clients across our entire company and the industry as a whole. But the facility managers' priorities, I think, have changed, and that they got caught a little bit off guard. There's a whole lot of just-in-time, lean design, all those kind of terms and topics that have been prevalent through the last 10 years caught everybody because there was no supplies available. They don't have a lot of motors on the shelf they can replace stuff with, and then things became very hard to buy. So there's been a real change in focus into how do we self-sustain on our own if we can't count on vendors or outside sources or things from overseas getting to us. I think that really shocked everybody. At the same time, there's been a much bigger focus on emergency management procedures. And we've actually started going through design scripts with our clients early in the projects about, here's kind of the layout of the systems. What if this line breaks, or what if, some big hazard happens in this part of the hospital? What do you do for it? And they entertain those kind of conversations and putting infrastructure in to deal with them a lot more than they used to. I guess they've afforded more dollars to deal with those kind of things than we ever used to get the attention to help deal with. I would say it's been interesting to watch the suppliers. We've had things like distilleries, local distilleries that were making bourbon and whiskey. Now they're making hand sanitizer. And so we would see these bourbon bottles in the hospital, but they were full of hand sanitizer. And it's really been neat to watch how some of these companies have adapted and started making products they've never made before, but just in an effort to help everybody out. That's just pretty neat to watch.
Right. So along those same lines, what has all of this had? What kind of impact has this had on the consulting engineering community? And how are you working differently?
Well, we personally, we're about 500 people across the country, and I distinctly remember a phone call, a leadership phone call on a Thursday morning when this was back in mid-March 2020, and we were talking about, what do we need to do? Or just getting concerned. Some people were already refusing to come to the office or leave their houses, and by Friday morning, we had disseminated everybody out of the offices to their homes. And we didn't really know if that was going to work. We had a whole bunch of projects on the books that hadn't really been impacted yet. That kind of came over the next few weeks. And so instantly overnight, we had to learn how to work remotely. And this was really before Zoom and Teams and all those were really prevalent. Everybody knew how to use them. And remarkably, it turned out really well. And I think it worked out really well for everybody across the industry. I think the owners are much more comfortable with it. Our clients are much more accepting if we attend a meeting virtually versus in person. So it's really changed the dynamic of how we work. And I think it'll help shape the way we work in the future. One of our biggest concerns was mentorship, because this is such a mentor-based industry. And we didn't really feel like mentorship was going to work very well if you're remote. You just don't see, you don't have those casual interactions with people like you would normally do in the offices. But I think you have to be a little more proactive about it and have some scheduled meetings and make it happen. But we're finding ways to work through that as well. And I think this is kind of blending into what the new normal might look like. I'll say from a project standpoint, we have the habit of liking to use the same types of products and the same vendors over and over because we trust them. We have good relationships with them. What we've seen happen is those products aren't necessarily available. And so now we're somewhat designing based on what's available right now versus what we would like to use. And that's not just us, that's our clients as well. Everybody's, they have an air handling unit and they like a certain type of motor, and that air handling unit may not be available. So we're swapping out pieces and parts inside that unit, really having to think outside the box on how do we get the products we need in a timely manner. We're as of last week, I heard air handling units have a 40 to 50 week lead time, and for a small project that becomes on the critical path, and it's really not acceptable to our clients. So how do you work around that and keep providing healthcare facilities for growing populations that desperately need them? I think one of the other interesting things I've came across in this pandemic is the engineering community got classified as essential workers by Homeland Security. And so when the state and local governments were telling everybody, stay home, don't go out, keep this pandemic in check, we got issued a letter that gave us basically permission to be out past curfews and basically to go wherever we needed to go to help serve our clients and keep things rolling. So I think that personally, it reinvigorated me. It was kind of nice to get that awareness and that sense of, hey, it is important what you do and you can be helpful. And I think it's kind of put a little spark in a lot of people's step in the engineering world that people needed us. And we know they do in the long run, but the compliments and the pats on the back are somewhat few and far between a lot of times. So that was kind of neat. It's scary and neat at the same time, right? We had people out in in hospitals that had a lot of COVID patients in them, and they were chasing down medical gas systems and trying to figure out why, things weren't working quite right. So they were all masked up and somewhat of a combat type situation. But it was neat to see everybody step up and really flex and do what they needed to do to help our plants get through it all.
Right. So a lot has changed over the past 2 years. What does the new normal look like from your perspective?
Yeah, absolutely. I talked a little bit about it before. I think the hybrid working environment is going to be here to stay. There's a lot of benefits from real estate costs and flexibility of workers. We've been able to hire people remotely outside of anywhere we have an office, and they've been able to contribute to our firm. So there's definitely a shortage of talent in consulting engineering world right now. I think everybody's feeling that crunch, and then the rush of work on top of that makes it that much worse. So we've really become a lot more flexible in where people are, how they work, when they work. As long as you get the projects done and maintain good quality and communicate, it's really opened things up. I think people are happier. They're getting to have this hybrid work environment where they're in the office a couple of days a week and they're home the rest of the time. And it's been a little refreshing from that standpoint. So I think it's kind of neat. And that's really everybody. That's everybody in the workforce, but it definitely has applied to the engineering community as well. I think from a healthcare caregiver standpoint, we saw a lot of telehealth start when so you could do virtual meetings with your doctors during the beginning of the pandemic. And I went through some of those myself, loved it. If you just have a routine checkup that you need to go in to do and don't really have any issues, it worked fine just to sit like this and talk with your physician and get whatever needed was done. So I think that we'll see that trend continue, I believe. I think right now that's a little bit held up with insurance companies and maybe not having the same reimbursable structure as they do for office visits, but I think you'll see a lot of legislation pushed and get that to pass. So we'll probably see the less minor procedure stuff done in hospitals. And the hospital areas will become higher acuity, and more of the outpatient stuff will be done virtually, I suspect, over the years as we see that trend change. From an overall working standpoint, I think there was a lot of silos that got broken down. I've talked to a lot of healthcare leaders and the security people and the facilities folks and the doctors and the nurses, and everybody really had to step up and work together and understand what the limitations and impacts were of the things that they do. There's a major supply chain interruption, and I think people that were ordering N95 masks from some companies, all of a sudden they couldn't get them from that group anymore, and another company had to step up. So I've heard stories about false sales. So somebody would buy masks from a company overseas, and that company didn't even exist. It was all up front, but they lost some money because of that. So that clients that were shipping people overseas to make sure those factories existed and that they could get the product they needed to keep their business going. So it's really changed relationships. I think people, the folks that have stepped up and have been able to react and respond during the pandemic are seen in a much better favor now than those that just couldn't react for whatever reason, that had breakdowns in their supply chain. So it's interesting. We all hope that we don't ever have to go through this again, but inevitably we'll probably have to go through something like this again. We've certainly had pandemics come up in the past 20 to 30 years, but this is the worst that I think most of us have ever seen. And it involved everybody. And it's just been interesting to watch everybody went through it.
Definitely, yes. And some fascinating insights. Thank you so much.
My pleasure.
Yeah, I've been speaking today with Darren Harvey from Smith, Seckman, Reid. Thank you so much for joining us, and goodbye.